All right, half a day. Welcome again to all of you who are here, especially those from the Guam Memorial Hospital. Thank you for being here today. The Committee on Health, Tourism, Historic Preservation, Land, and Justice is now called to order. Today is Thursday, February 14, 2019, and the time is 2:13 p.m. Notices for this hearing were disseminated via email to all senators and all main media broadcasting outlets on Tuesday, February 5, 2019, and again on February 11. The notice was also published in the Guam Daily Post on February 7 and February 12, 2019. We only have one item on the agenda, but it's a big one. It is to receive an update, a status update from the Guam Memorial Hospital on the Centers for Medicare and Medicaid Services, Plan of Corrections, and pending CMS certification. I'd like to thank my colleagues for attending this afternoon's hearing, beginning with Senator Terlaje, Senator Will Castro, and Senator Amanda Shelton. Thank you very much for being here. And I'd like to, again, thank all of you who are here attending. I'd like to thank the Guam Memorial Hospital Authority Acting Administrator Lillian Perez-Posadas, RNMN, and the Chief Financial Officer Benita Manglona, Peter John Camacho, Dr. Annie Berdalio, Dr. Duenas, Jenabeth Simbilo, is that correct? And I know it's Zaudi Tugadi, and could you please introduce Lillian? William Kendo? William Kendo, thank you very much for being here. I'm sorry your name's not on this list, but yes, thank you again. I know this is the administration's team for the CMS certification, so thank you again. Medicare is the federal health insurance program for people who are 65 or older. Certain younger people with disabilities, people with end-stage renal disease or permanent kidney failure requiring dialysis or a transplant, sometimes called ESRD. In June 2018, based on a Medicare recertification and complaint survey conducted at the Guam Memorial Hospital on April 27, 2018, the Centers for Medicare and Medicaid Services, or CMS, we will be using the word CMS throughout this hearing, determined that GMHA remained out of compliance with requirements for participation as a provider of hospital services in the Medicare program in 7 areas, and CMS intended to disqualify GMHA effective October 3, 2018. GMHA submitted a plan of correction in June 2018, and in August 2018, CMS informed GMH that it wouldn't immediately lose Medicare funding because the hospital's corrective plan was credible, and that an unannounced visit would be conducted by CMS to confirm the hospital is following its plan. It's our understanding that in January, beginning in January 29, 2019 through mid-February, a 4-member CMS surveyor team conducted a site survey at GMH, and the CMS surveyor visit ended with an exit conference held with the leadership, detailing their findings on or about February 7, 2019. And so, again, thank you to all of the panel members here. And so our first question is really just, if you could explain, Ms. Posadas, the impact to GMHA patient services if eligibility to participate in Medicare is terminated. If CMS went through with their threat of termination, what would be the impact of that on patient services?
In terms of the impact to patient care services, it doesn't really have that impact because we continue to provide the quality and safe patient care at the bedside and throughout the clinical. But as far as finance, that's where we will receive the impact, because if we do, if they discontinue or they terminate the certification, then we will not have the reimbursement at all from Medicare for federal money. So that's where we will see the significant impact, and then of course it will then trickle down to where it will affect our resources, our inability to get resources.
Okay. Were they threatening an entire termination, and what would that amount look like, for example, in one fiscal year?
It will look like about $2 million in terms of one fiscal year. or more than.
You're talking about the payer mix of Medicare, which is
Yeah, the matching fund.
about 20%, 20-some% of the payer mix of GMH, but then you have to take into consideration also the Medicaid, because that's we're being reimbursed by how Medicare pays us with Medicaid. So you're talking about over 50% patient mix that's going to be impacted.
Including in
What was the percentage?
It will
Over
be
50.
over 50%.
What does that look like in?
Dollars?
Yes.
You're talking about close to 40 million?
All right. I'm just wanting to review this as a little bit of review because for all of us, I was a new senator last year, that was news to me. I didn't understand the impact of termination, and so I just want that to be very clear for those who are listening. And I know that's just a very, very basic understanding of it, and that hopefully as we engage with GMH throughout the term, we will all be very much better versed at the implications of this. So the 7 areas of non-compliance that were identified in April 2018 were described as, and these were general areas.
Categories.
Yes,
correct.
categories. Governing body, quality assessment and performance improvement,
Correct.
nursing services,
Correct.
radiologic services, physical environment, discharge planning, and anesthesia services. So if you could, what is the compliance status of GMHA in these 7 areas, and are there still unresolved areas of non-compliance?
No, they accepted our plan of corrective action last year, and so therefore we did not lose, and there was no further threat to lose the certification and the funding. And so of all those 7 areas, 7 categories, first one, governing body, you know, what the specific citations were that the governing body, there were 7 elements also under that governing body that addressed QAPI. The governing body did not make sure that there was an active hospital-wide quality QAPI program. That's the Quality Assurance Performance Improvement. And, you know, it referenced also the anesthesia. It referenced discharge planning. It came across, it cross-referenced those other areas. So that's the governing body. The other element of the governing body was the medical bylaws. There were some areas in the medical bylaws that the governing body did not ensure proper validation of the credentials of the medical staff. There was another element to that. If you just bear with me, I came prepared with notes, but kind of threw off with the questions. The other elements of that governing body, patient safety, the anesthesia services, which I mentioned, the failure to ensure the organized nursing services that meets the comprehensive needs of patients, that again cross-reference over to the nursing care plan and the discharge planning, and the safety performance improvement that were all part of that. Under the governing body, the 4th element was the effective and organized radiological services, that professional standards for patient safety and personnel qualifications. And that was relative to the incident in the radiology services, where one client, you know, there were some situations where it wasn't reported, the incident. So again, it cross-referenced across QAPI, nursing services, radiology, because the incident occurred in radiology. The life safety code under the governing body, discharge planning was the other one I mentioned, and anesthesia department. They were not integrated in the hospital-wide QAPI program. So there were a lot of cross-references under the governing body under that category. The other condition was the executive responsibilities of QAPI. There you see again a cross-reference with the governing body's QAPI issue. Medical staff credentialing was also specifically mentioned as a, you know, another condition of participation, and Do you want me to elaborate on that one, or?
Not at this
No,
time.
okay.
Actually, what I would like you to focus on is because, yes, so I know that the list was so very extensive,
Right.
and it cross-referenced other
A
areas
lot.
on the 7 items. Like, for
Right.
example, like you said, the radiologic services was one area, and then they cross-referenced that to the
QAPI
the
and
governing
safety
body
and the
for
governing
not
body.
ensuring
Right.
that the radiologic services were
Right.
correct. Okay, but pretty much I want this hearing to focus on, we are under the impression that GMH is complying, that they sent a letter with a plan, and that CMS agreed that the plan was
Accepted
credible, accepted the plan,
Right, and approved it.
and held off on the termination. So
Correct.
congratulations and good job on the planning. So I guess we're here because I want to make sure that what's left on your plan to achieve, and now that we have a change in administration, are you still on track with your plan? And is there any help you need with your plan? And in particular, when CMS came recently, that was the unpredicted visit, I'm guessing.
It was a revisit. It was a
that-
revisit.
Yeah, the revisit. What are they telling you now? And are you able to handle what they are telling you? Are we going to be on track again? Or are we at risk? That's pretty much the main question is, we want to make sure before we find out that it's too late, that we are still on track, or is there something that you are worried about that we are not going to be able to meet, or whether we are okay? I guess I want you to brag about these items are completed, and maybe we don't need to go there, right? And I don't want to underplay all the work that you've done, but just in the interest of time, we do have the report, and I will share with the committee that your response, the CMS's list of items, your response, and that was accepted. But now we're back to, so they reviewed you again. So where are we, if you could just update us on that?
With the revisit, I really cannot disclose too much of it because their advice was that what they found preliminarily is subject for review by their superiors. But they do recognize that we have made great strides in improving patient care. We still have a lot of work to do on the QAPI part. We have made tremendous progress, but we still need to continue the momentum, the movement. And part of it is the resources. We're still needing resources to really make that QAPI program robust and everybody be engaged in it. And, really taking it further, not just collecting data and just for the sake of collecting, but really analyzing what that data is telling us to then therefore improve the patient care that we provide. And so that's going to be the next level of our QAPI process, that we're moving in that direction. And we are bringing in some resources, some human resources, individuals with master's degree in QAPI who can then help us continue and intensify that movement further.
Okay, if I could just remind my colleagues, QAPI is Quality Assessment and Performance Improvement.
Quality assurance and performance improvement. Yes.
Quality assurance and performance improvement. Okay, thank you.
They go together.
All right.
Assessment and assurance.
Assessment. And so
Right.
it's been collecting data, and now you are, and their challenge is to analyze and use your analysis to improve patient care.
Right. That's
And-
really the purpose of QAPI.
All right, and your plan was to bring in human resources
Additional
to
resources.
to assist in that.
Right, exactly.
And so you're on track with that?
We
you
are.
believe? Okay.
Yes, we are.
All right. Are there any unresolved areas of non-compliance that you are worried about?
Again, based on those 7 conditions that we were cited, we continue to make, the improvements. The radiological condition, that's resolved. Some of the structural, like the doors, that's ongoing, and it's contingent on the purchase order that have been submitted. So, the finance is where it's key to get those, items to help us with the
right.
resolution of those findings.
Are there any deficiencies that you're finding difficult to correct?
Not at this point. We are moving along with bringing in the resources. deficiencies in terms of the...
The CMS list.
The CMS. But there is a deficiency that I like to put on the table that we really, really need help with, and that's the electrical panel.
And that was not on the list?
No, it's not on the citation, you know, but that is something that we are very concerned with regards to, you know, patient care outcomes.
Yeah, if I may add to what Lillian is saying about the panel, it wasn't on the list, but during this most recent survey, they actually asked us to do a chronological order of events on the panel. They wanted to know exactly what's going on with not only the recertification of designs, but where are we in the process of replacing it? And because I even asked one of the surveyors afterwards, why didn't they talk about it during the exit brief? And they said because we're showing them, we're demonstrating that there's progress and that we're going to be replacing it. And so that actually transpired during the survey. All
right. I know that electrical panel was something that was brought up on the list of priorities for GMH to address, that they brought it up, that they needed to address this, and
it still is our top priority.
Still a priority.
Yes.
But I guess so. If you could explain, so the legislature in FY19 gave $30 million to GMH.
Correct.
And it was a little more than what was given in previous years. And I guess I had heard that this electrical panel was taken care of with part of that money, but if that's not the case, then if you could clarify. So that's not been addressed at all, but do you have a credible plan to address it?
What we have done, Senator, is worked on the revalidation of the plan, and I think that's ongoing right now. And then once that revalidation happens, that's expected in May, then we're going to start proceeding with the procurement of the electrical panel. You know, if you recall, we had requested for operational funding, and that 30 million was for operational subsidy. We did also request for capital improvement, but we didn't receive any funding for capital improvement. So just based on the resources that we have right now, we're trying to address that, but we do need help for CIP.
Senator, switching over to your earlier question with regards to, are we still needing, you know, struggling with some of the corrective actions? I'd like to retract what I said, because nursing, we are really very short of nurses. We are short of allied health professional support staff, and that's where our struggle is, because it does impact in terms of the QAPI program, that we need to really make it a very robust program and very engaging program and active. And also in terms of documentation, the nursing care plans, discharge planning is another condition of participation that we need nursing staff. You know, those are still some of the areas that we're struggling with.
Is there a plan to address that you're satisfied with, or is it even the planning that you're concerned about?
It's the recruitment and retention planning is what we need to really put some energy into, to recruit nurses and retain them.
All right, I understand, Lillian, that you will be, you know, of course, collaborating, as all the previous administrators have done, with the University of Guam,
correct,
GCC, with other stakeholders in the community to help to address this. Is there, I guess I would look forward to, or we would welcome your insight as to how we could all help with that. We've heard different things in the past, but I guess we can leave that for another hearing, and just to discuss that in particular, if that's a big issue. Maybe that's something we could do a roundtable with the other stakeholders. Correct. But I know that you've done a lot of work already in this area, so I don't want to, you know, slow you down. But maybe in a couple weeks we'll come back and we will address that, and we are open to any solutions that we can assist you with. And I know that it takes a coordinated, you know, education, training, and all of those areas. Salary, I understand, and to be competitive and to retain them. So we will work with you on that.
Okay.
Senator, if I may add,
Yes.
Lillian mentioned there's one set of double doors that we need to fix, and that's at our cafeteria. But the other citation, which is a citation from the original survey, is the we're putting in a fire-rated enclosure that requires, it's not a big area, it's a small area in an exterior corridor just outside of our materials management office.
Which
and
office? Sorry, say it again. Which
it's
office?
Materials management, our
Okay.
procurement office, fairly close to the backside of our dietary as well. And this is not a difficult project because it involves using concrete board, but it requires 4 sets of doors, fire-rated doors, and those are coming from off island. So though we didn't, they let us know that we didn't meet their original deadline, which is in the latter part of January. And so that's going to be in our report back to them, how we're going to get that done as quickly as possible. So we're on schedule, I believe, to complete that in the latter part of April.
April? Latter part of April?
Latter part of April this year.
All right. If you could maybe just elaborate a little bit more on, with the existing funds, if it was supposed to be for operations, that's correct. Very little was dedicated to capital improvement. But you've been able to address many of the CMS concerns or make a plan to address them going forward. I guess I'm worried about 2019. So 2020, the budget, of course, we're going to have to talk about that. And I am sure we are going to hear from GMH its priority list of how to, prioritize our funds to address the most pressing needs, or what you feel are the priorities. And so we're looking at you for the priorities. But for 2019, I guess if you could just elaborate on how we're okay going forward in 2019 with the funding and the most pressing CMS concerns, to stay on track on that, I guess, is what my biggest concern is.
So, so Senator, for 2019 operation, if we were not to address any CIP, we will be okay, but because we're trying to address CIP projects at the same time, we've had to hold back on, on operational expenses, and this 2019 is also impacted with the shortfall of 2018. Part of that was, not getting paid for the DLC clinic. Of the close to about $3 million, we will only receive like over 600,000 because the appropriation was only for about 600,000. And there's also inpatient billing that have not been paid for DLC, and I understand that their challenge in the appropriation that they received on an annual basis. But despite that, we still provide the service to DLC, and we still work together with them. So with the resources that we get, we're very frugal in our expenditures. We prioritize life safety expenditures whenever a department comes in and say that we need this because we need it for a patient, we need this, for life safety reasons. Those are the type of expenditures that we prioritize, and sometimes it's not budgeted, but it's something that equipment breaks down, and we have to prioritize buying that. So we try to reprioritize resources based on what is happening at the time.
All right. Okay, so if I understand correctly, then you're juggling operations funds.
That's correct.
And even though you did not receive CIP funds, you're using operations funds to take care of some CIP projects that have to be taken care of right away, some equipment that has to be taken care of right away, and all right. And
we try to work with what we have.
All right. Okay, well, it's always going to be a challenge. I know that, and you know that, but we're going to do our best. And so I appreciate that you've been able to prioritize that way, that continue with the operations. Nothing's been shut down as far as we've heard. And you seem to be on track with CMS, which is excellent, despite the challenges. And I am sure you're planning for more CIP improvements. And I guess we're going to see this in your 2020 submission, but maybe you could just say a few of those on the record. What are the absolute priorities when it comes to CIP at the hospital? Maybe your top 3. Do you have them listed?
Electrical panel is one of them.
The electrical panel,
Yes.
okay. What is the estimate on that at this point? I know you have a new plan.
$6 million.
$6 million.
Okay.
Another one would be our fixing our roof.
The
Our
roof's
rooftop.
not fixed yet?
Not, we've done, Zaldi and his staff have done a great job on doing the short and intermediate term fixes, the Band-Aid fixes. But the permanent fix is to do a design to completely replace the deteriorated membrane on the roof that needs to be removed and completely replaced, as well as the envelope of the building, the doors, the resealing of windows, anywhere where water can come in, especially during typhoon. So it's a fairly major project that requires a design phase.
All right.
So we got the roof.
Let's take a pause on the roof for just one more second, because that's the one that's most obvious, I think, to your patients and their families. And you said a Band-Aid fix, or you fixed it up enough. Mr. Tagari.
Yes, ma'am. Good afternoon. We did submit in our CMS three stages of rectification. One is the immediate, second would be the intermediate, and then the final solution. So we've done the immediate, which is to address as we see it fit. Second would be the intermediate, where we just finished and try to make sure that that would last us at least a year while we're working on the permanent fix. So that's where we're at right now. We're gonna need, like William says here, we need an A&E, architect and engineer design group, to come over and assess exactly what we need so they could specify the right material, the right engineering system that we need to address all this water that comes in during typhoon.
All right, and so that was not an item on the CMS list,
No.
the roof.
It wasn't.
So neither the electrical panel nor the roof.
Correct.
Okay. Yes.
But the electrical panel is, CMS is
Current.
is
It's a
aware,
new- it's a
currently
new
aware of it.
item.
Yes. Well, they started following it with all the wonderful media publicity that we
Yes.
started getting last year.
I remember. I remember that. Unfortunate.
And also as a result of the electrical fire and the
Yes.
telemetry unit.
And
Because
that's
we actually have to submit an after-action report on the fire to CMS.
CMS, correct.
Yeah.
So that's another, I didn't include that here, but I know that's another issue that CMS is following, so you're addressing
There was
that.
that was one of the complaints in the revisit. Of the 12 complaints, that was one of them, and I think that is one of them that was unsubstantiated. There was no deficient practice.
I see.
But it's an issue and a concern
Yes, okay.
that we
And
need to continue chasing.
all right, so and you were on the list of the top 3?
Another large project that is critical for us is the Family Birth Center. But we're still trying to work with GIDA
GIDA and USDA?
Right.
to work with the USDA, try to get the loan.
All right, was any part of that project to include the roof or repairs on the roof? No?
Not the roof on the
The
A
other
and B
side.
wings.
Okay.
But it has benefits, that project, because by enclosing, when we enclose the front courtyard and go up 2 stories, because the second story would be the new NICU, you're going to prevent water from coming into those main corridors on both the first and second floor. That's going to be helpful.
I see.
But it's not the major fix that we're talking about.
All right. Okay, that's fair. And what are you having any progress with GIDA?
Well, we just corresponded this week with GIDA, and so we're letting them know that, yes, we want them to go out with a 6th RFP for interim financing. But before they do that, we want their advice and the USDA's advice, because we're going to go back to our A&E firm and have them give us an updated construction cost estimate. Because that original loan of $9.2 million several years ago, that may not get us to where we need to go.
Right.
And so we want an updated construction cost estimate, and then we would want them to proceed with that interim financing.
All right, there's been some talk in the media about additional Section 30 monies that might come in to Guam during FY19. And if I guess that's the case, I guess I would like to know from GMH if you believe GMH is an area of priority where any excess money should be focused. All right, well, if you could, where is the best place for members of the legislature to look at your priority list that is not being covered by FY19 funds? So would that be in the 2020 proposed budget or in another plan or a CIP plan?
We do. Go ahead.
When we had submitted our 2019 budget, we had in there the list of CIP projects. So that really hasn't changed much.
Okay.
You can go to the 19, and we can provide that information too.
Yeah, that would be convenient, but
yes.
Okay, so that's good to know. So the 2019 list is pretty much not changed. Okay.
Correct.
All right, except for the CMS most pressing items.
There could be some items in there that we have already procured through the volunteers or you know, with whatever funds we have, because some things broke down. And
yes. Maybe if you can send an update.
But we can provide an update.
Yes.
All right, and then finally, what about, were there any promises made to CMS regarding funding or, you know, things that you were going to address that you are worried about obtaining funding for, or you're pretty much set with what you've promised?
We didn't make any promises.
Well, we have done what we said we were going to do, but I guess in the exit conference that we had with CMS, they actually, you know, in so many words, and every surveyor there mentioned allocation of resources.
Yeah.
That we have to allocate resources to certain, you know, citations, and it could be equipment, it could be manpower, but we heard the term used, allocation of resources, many times. So it was like loud and clear that we have to prioritize and allocate resources to these areas that are being cited.
All right. Okay, and then I'm going to ask this general question and then open the panel to my colleagues. So after the recent CMS visit, is it your belief that GMH is at risk of losing CMS Medicare funding for FY 2019 at this time?
No, they didn't.
think so.
There was no indication that that we were threatened with losing funding.
Well, congratulations.
I didn't sense that. And
thank you for your hard work on all of those citations. Thank you very much. And Senator Shelton, and I'd like to welcome Senator Clinton Majel also. Thank you for being here. And Senator Taitano, thank you for being here. Senator Shelton, if you have a question.
I don't have a question, but I wanted to say Sejus Masi for the refresher and for the update, and I wanted to commend you on the CMS rebasement and the refund, so congratulations on that, and thank you very much for your hard work in getting that done after all of these years. Thank you.
Thank you.
yes, thank you.
Lillian, I read some of their names, but I don't think I did justice to your team here. If you could just introduce them and tell their positions so that everyone who's watching and listening also could understand their role in assisting with your work.
Sure. To my right is Peter John Camacho, who is now overseeing the professional support division that covers radiology, respiratory, rehab, dietary, social services, and pharmacy and laboratory. Those are his areas that he's covering. So he's going to be cracking the whip on Quapi on those departments. William Kando, he's our chief planner. He's our institutional knowledge with regards to grants and, you know, what monies are coming in and what are being expended for what projects. And then Zodi Tagadi, he is our facilities maintenance manager. He's the one I go after when it comes to the boiler room and the fire alarm. So, you know, that's Zodi. And then to my left, Benita Manglonia, our CFO. And Gemma Simbilo is our nursing director. She just rejoined us a month ago. She came back to us, to Guam Memorial Hospital. Then we've got Dr. Annie Badalio. She is now our Chief Medical Officer or Medical Director. And to her left is Dr. Duenas, who is still helping us out, with the Medical Director responsibilities. And Dr. Jolene is, okay, I see. Dr. Jolene Ogden also is now helping us with the position of Associate Administrator of Clinical Services. She's overseeing the two arms of the clinical side in terms of nursing services and professional support. And I also want to recognize Danielle Manglonia. She is the Regulatory Compliance Administrator, and I want to applaud her and commend her because her intensity and her diligence and chasing the managers to get these things done for the CMS, she was very, very instrumental in getting our plan of corrective action together. So I want to applaud Danielle Manglonia. We also have Dora Cruz. She was acting nursing director while we were waiting for Gemma's arrival. She's also acting deputy nursing director. And we've got Trustee Sonia Cillian. She's our public member of the Board of Trustees. And we've got Paula Manzan. She helps us with the informatics. And Janina, she's also helping out with the case management and discharge planning. She was pretty instrumental in launching that as part of our corrective action. And we've got Rose Cruz. She is our administrator for HR. Did I miss anybody? Oh, sorry. The gentleman on my right side here. We've got Carlos Pangilinan. He's our management analyst. He helps Benita with the on the finance side of the house. He was very also instrumental with the CMS rebasing. And I don't know the gentleman there. Joe? Oh, okay. Joe is Gemma's husband. He's important. And we've got Gordon. Gordon Misuzawa. He helps us with our environment of care.
Thank you all, and welcome back to those who are back to GMH. Thank you for those who have been there for many, many, many years. Yes. Congratulations to Dr. Badalio on your new position, and thank you. All right, and Senator Taitsugui.
Thank you, Madam Chair, and congratulations to everyone here. I'm glad to see that you've kept several people on as well, and congratulations to your new position.
Thank you.
You have a wealth of knowledge behind you, and plus as well as yourself.
We have a dynamic team.
Exactly. A good team, and that's what your husband would say, we got a good team.
Yes, he's my coach.
Right?
Correct.
I just have a question with regards to your collectibles. Is there anybody here that does billing that you're any chances of you're looking into upgrading your billing system?
In fact, we met with the OPA the other day, and those are some of the things that he has shared with us in the audit, was our billing and collection processes. We really need to work on it because some of the policies are kind of old, and we need to work on them, and we do need to have a really robust collection process. And so I talked to Fred over at Attorney General's office, and he's going to help us with the collection services so we can go after these individuals who we can collect some money to pay for the services that we provide.
Well, how about the insurance companies? What insurance companies have not been paying on time, and what insurance companies are in good standing? What do we got on there, and how much do they owe?
We work closely with the insurance companies, and we meet with them regularly. We owe some money to them too, because for a while we weren't paying our premiums. So we try to balance that and tread kind of lightly, but we are very aggressive in collecting from the insurance.
Is there any, Benita, is there any insurance company that tends to not pay on time quite a bit?
Well, we did have, and we have that issue, but they have come around recently and have been working with us. We're meeting with them on a weekly basis now, and they've started paying.
Paying up?
Yes.
Maybe we could get the Attorney General on them too as well. you know.
Yes.
They're the ones that owe the most, I think, if anything. Other than that, I really appreciate all the hard work you've done, and you know, I hope I have the same kind of support. I put out a bill when I first became a senator this round, and it's to build a new hospital, you know, and that's my goal right now. I know all these Band-Aid fix that you have, and when I hear $6 million, and I think of, wow, that can go to a new hospital. We can build a new hospital. You know, our people deserve it, so I hope I have the support of your group here. And thank you again for your hard work. Keep it up.
Okay. Yes.
Senator Castro.
Thank you, Madam Chair. First of all, congratulations on the appointment. Congratulations to your team. As the chairperson aptly noted earlier, the latest is a culmination of work that has gone on over a period of time. I remember sitting in the cabinet and working with a lot of your professionals behind you, so I want to thank you publicly. I also will be asking the chairperson of the committee for another opportunity to sit with your team at GMH to go over some of the recommendations that were in the HMAT consolidated report. And also you put together another piece, the business sustainability plan. And in there it's delineated, you know, in terms of CIPs and other strategies for cost containment, cost cutting, and revenue enhancements. And so I think therein lies a lot of the opportunity for additional forward progress. And so with that said, thank you again, congratulations. I have no specific questions relative to CMS and what we're discussing for today's briefing, but I do have a request, and I'll follow up with the appropriate chairperson and your team when I could sit with you again and tour the facility and talk about those issues once again. Thank you.
Thank you.
Thank you. Senator Marsh.
Hafa. So I want to add my appreciation to the others. It's so vital to the community, of course, that GMH is working at these plans of correction, and they are tackling these sort of issues. And I want to, as I said, add my appreciation for the hard work and the effort that it takes to make that happen. We've been hearing about health this week, and if I could ask a question that's related, but perhaps just kind of related to the larger issues that we've been looking at this week. Can you explain, please, the process of how GMH produces its fee schedule? And I'm interested in seeing how that ties in with our Medicaid and Medicare programs.
Charge master.
The charge master, we have done a lot to our charge master. In 2015, we had engaged a company, Craneware, to update our fee schedule and cleaned out our charge master. And we have increased our fees by 5% each year. And that's about what we could increase it to without having to come to the legislature. And I'm glad that you had brought this up, because I wanted to we need help in getting our fees updated, some of it, especially those fees that have fallen below Medicare rate. And that usually happens like in November of each year. And we did come to the legislature before, back in 2015, and we were able to raise about 300. We requested to raise about 400 of those fee items that fell below Medicare rate, but we were only approved for 300. And there are some that have fallen below Medicare rate, and it takes a lot of administrative time to go through that process to have our public hearing and then come here. But if we are given the authority to just raise it every time, when it falls below Medicare rate, it will save a lot of time, and then we can just change it. Right now, we have our fee increase every April 1st. That was one of the citations from the Office of Inspector General report that was released in December 2014, and so that was one of the findings. So that was our way of correcting that finding, was to have the annual update each year. How we raise our fees, we, when whatever new items come in, we look at the cost, and then there's a capitation on how much we can charge, and it's based on an old fee model, and we're also looking at that and proposing to the board on how we can fix that, so that we can actually try to break even. We have looked at that, raising the fee across the board, but it's going to be very, very huge, and I don't know if the community would be able to afford that. We're always looking for ways to work with the legislature and assisting us in that manner, and that's why we have that operating shortfall, because some of our fees are, still not up to where it should be. And with this rebasing, that would really help the hospital, because at least from the 3M's perspective, which is Medicare, Medicaid, and the medical indigent program, it would raise the reimbursement rate, even though it's still not quite up there, because the rebasing is based on the 2013 rate. Our cost has gone up. So we will continue also to work with Medicare in requesting for annual adjustment. That's an additional reimbursement for GMH, even after the rebasing.
Therese Masi, for that answer. It really helps me understand some of your correction plans, some of your future needs, and it also sheds some light on the issue that we were looking at earlier this week between with the insurances and the different rates, but certainly it's important to be providing support and to be understanding how we can be helping the hospital better make ends meet and have a balance to it. Therese Masi.
Thank you.
Thank you. Senator Vigil. Senator Shelton.
Mrs. Manglotnia, can you give us an idea of what that timeline would be if you were to bring a proposed fee schedule before the legislature? I know you mentioned your own public hearings, and do you know what that timeline would look like?
Well, we do have a quarterly public hearing at the hospital, and these are for fees that we introduce within that quarter, and that's just part of the AAA process. It's like a couple months. And then, once we have our public hearing, then the next board meeting we present it and get the board approval or resolution approved, and then we forward it to the legislature. That's for new fees. For the 5% increase, it's automatic. We have board approval already for that, every April 1st we raise our fees 5%. So come April 1st, it will go up to by 5%. There are still areas that are still very low, because these rates are since the 80s, and when we started raising it by 5% in 2015, just imagine how many years these fees were not raised. So we have formed a committee to look at the room rates, because there are denials from the insurance companies that they're claiming that these are like routine supplies, or they should only be charged with this much of underpads, or things like that. So we're looking at trying to add that to the room rate, so it will also cut down on the denial process and just add it on to the room rate. So, but with this type of committee, we do need all the clinicians involved, because they're the ones that do, patient care, so they know, they have more information what would be the average utilization of those items.
Okay, thank you.
Senators, since I have your attention,
yes,
and
please,
the offer to what you can do to help us, there is a group of clients that we serve. They are the self-pay clients. That's where we're going to need your help to find ways how we can help those individuals who are who claim themselves to be self-pay and they don't have any, resources to reimburse the hospital. What ways can we look at in terms of a government, entity to cover those costs for the self-pay clientele? I'm asking for your help in that respect, as far as help us capture something or get reimbursed for those groups of clients. It's a tough challenge, but.
If I may, to add to her comment, we do have a number of social cases at the hospital, and for the benefit of the new members, these are patients that are at the hospital that don't need to be in the hospital. Some of them are occupying acute care bed that could be going to a person that is waiting for a bed in the ER. These are also patients that are at the skilled nursing unit that do not meet the criteria of continuing to stay at that SNU, but we can't discharge them because they don't have any place to go, or they don't have any family members to take them. And so when we can't discharge anyone if there's no one to discharge this person to. So that is really an ongoing problem of GMH, and that contributes to the operating shortfall, because one patient could accumulate over $500,000 in fees in a year at the hospital.
How many of those patients would you say you have?
On the third floor, we have about 5 occupying acute care beds. Up at SNU, we have about 2 or 3.
All right. Thank you again. Any other questions? If not, again, thank you all very much for your answers and for your planning and for your hard work to achieve success with the CMS and with the rebasing. And I'm wishing you all the best going forward in this year. Yes. And we are here to help you, so we will be in close contact.
Communication.
This hearing is ended.
Thank you.